to the Here and Now show. My name is Koryn.
My name is Brett.
We are audiologists who love to share stories about children all over the world so we can help them. On today's episode, we are featuring Jamie's story. Jamie is a 4-year-old boy who loves to play with all of his brothers and sisters.
We are going to discuss his background, his history, and the results from his audiologic journey. He is an adorable patient of ours, so we wanted to include a picture. Oh my goodness, how cute is he?
He is so cute. Oh my gosh.
We first saw Jamie a couple months ago for a routine hearing test. Throughout this first appointment, we conducted a case history with his parents. We learned a lot about Jamie. We first learned that he has no family history of hearing loss or other diagnoses for that matter, like ADHD or any other learning disabilities. Yeah, anything like that. His parents told us that he was born at 34 weeks via C-section and weighed just over 4 pounds, so he wasn't very big. His mother had preeclampsia at the time of his birth, but she denied use of alcohol or any harmful drugs during pregnancy. He spent the first 3 weeks of his life in the NICU because he was having a hard time breathing on his own, and he had a really bad infection. In fact, his parents think the results of the torch test, which is a blood panel, that he was given shortly after birth is what caused him to go to the NICU. He was given a medication which his parents think was gentamicin, an antibiotic for this infection. Jamie passed his first newborn hearing screening, but did not pass the second one. This resulted in him getting an ABR, an auditory brainstem response test done. The results of this ABR, when he was 6 weeks old, revealed a mild bilateral hearing loss. Jamie has been wearing hearing aids since he was 8 weeks old.
That is so awesome. We love early intervention and diagnosis. We learned that Jamie reached motor milestones on time, like sitting and walking, and he even reached speech and language milestones on time, like saying his first words at 13 months. He now uses full coherent sentences that those outside of his family can understand, like us. He responded to his name when we said it out loud, and he played well with us during the appointment. Jamie's parents said that he does well at school with his friends and that his teachers do not have any concerns. His last hearing test was a year ago, and his parents told us the results of that hearing test was stable.
Interesting. What does stable mean, Koryn? Who knows?
One may never know.
We also learned that he wears his hearing aids for about 11 hours a day, which is awesome, and that he generally likes wearing his hearing aids. Jamie used to see a speech therapist, but has since graduated out of it because he is a rock star, which we learned. Jamie and his family were referred to the ENT, but they had a bad experience there and do not plan on returning. They have also been referred for imaging and for genetic testing and genetic counseling, but have not pursued these services. Their overall concern when they came to us that day, a couple months ago, is that they just want to make sure that Jamie is still doing well with his hearing aids.
Aw, they're such great parents.
They really are.
Anyways, a few assessments were performed on Jamie. Otoscopy revealed a cloudy TM in the right ear and a brown amber coloring TM in the left ear.
The TM is the eardrum.
Yes, that is correct, Brett. We typically want to see clear TMs in both ears. We then moved on to condition play audiometry using inserts. Jamie loved to play our listening game and engaged well with us using the blocks to respond to the tones. Air and bone conduction testing revealed a decrease in air conduction thresholds of 35 dB, sloping to a 55 dB across frequencies of 500 to 6,000 Hz. The air conduction thresholds were approximately 10 dB poorer than past testing in the low frequencies. After doing air and bone CPA, we noticed CPA is condition play audiometry, by the way. We started to lose Jamie's attention and made the call that speech recognition testing could not be completed reliably at this appointment. We did, however, get tympanometry done and found that Jamie had a type A/S shallow tip for the right ear, which showed that his eardrum was not moving quite as well as we hoped. A type B tymp was revealed in the left ear, but after looking at the volume, we came to the conclusion that volumes were normal in both of the ears.
Jamie shocked us and let us perform one more test that day. Woohoo! We decided to test otoacoustic emissions, which are the response from the outer hair cells in the inner ear, and we wanted to test these just to see how those outer hair cells were doing. The OAE showed reduced amplitude responses in the low frequencies up to 1,000 hertz, and then no response for frequencies above 1,000 hertz. So now that we knew the case history and the results from the diagnostic testing, we had to think of some recommendations and referrals to make to get Jamie on the right track. So after we saw him, we came up with a recommendation the referral to an ear, nose, and throat doctor for a possible middle ear pathology, because it was noted at the time of the appointment that he wasn't feeling his best, and with the abnormal tympanometry, we just want to make sure there's nothing going on that's going to stop sound from getting to his ear even more so than his hearing loss. So we referred for that, and we also will include in the referral to have the ENT follow up about imaging and MRI and CT results, because that could possibly help determine the etiology of Jamie's hearing loss. We also recommended pursuing genetic counseling and genetic testing to determine the etiology of Jamie's hearing loss, because the family has been recommended those services before, but they decided not to pursue those. Since Jamie is in school, we highly recommended that he receives an FM system for the classroom. This system will directly work with his hearing aids and will give Jamie a higher signal-to-noise ratio in the classroom. This ensures that Jamie will not miss out on any important information in class. We discussed how to pursue this type of help and assistive technology in the school system by informing Jamie's parents about 504 plans versus individualized education plans, and about Jamie's rights in the school system.
Some other recommendations are some new ear molds. We will order full shell silicone ear molds for Jamie. We are also going to schedule a hearing aid service to check the function and output of his hearing aids. We want to make sure they fit to targets obtained at our evaluation, recheck thresholds, and conduct tympanometry, which is the middle ear system. We also want to schedule Jamie to be seen here at our clinic every 6 months for a routine hearing evaluation and hearing aid service appointment so that we can stay on top of any changes that may be happening.
Yes, and now it's my favorite part of the show. It is Guess That Etiology!
Game. Today I have Bailey and Christine playing. Alright, you have 5 seconds to answer. The question is, guess the etiology of Jamie's hearing loss. Ready, set, go! 5, 4, 3, 2, 1. Christine?
Gentamicin.
Wow, that's a good guess. Oh, Bailey?
CMV.
Wow, what good guesses. Wow, those are really good guesses. Thanks, Bailey and Christine, for playing with us today. Even though those were really good guesses, I'm going to have to side with Christine on this one. I think it was gentamicin. It has been reported that hearing loss caused by ototoxic medication, meaning medication that is harmful to the auditory system, is responsible for approximately 4% of childhood cases of hearing loss. This is quite low, but given Jamie was likely given what we believe to be gentamicin in the NICU for an infection, this is a reasonable guess for the etiology of Jamie's hearing loss.
That is a really good guess. My guess, though, I'm going to have to side with Bailey in that congenital CMV caused Jamie's hearing loss. A recent review estimates that congenital CMV infection accounts for approximately 21% of all childhood hearing loss at birth. And this percentage only increases as children age because it can cause later onset hearing loss. I think I side with Bailey that the etiology is congenital CMV because Jamie had an eventful delivery, and even though there are some holes in his parents' pre- and perinatal history with Jamie, the mother's belief that it was the result of the torch test that sent Jamie to the NICU, where he was given an antibiotic, makes me think that it is likely congenital CMV. Hearing loss caused by congenital CMV can present itself in a variety of ways. It can range from mild to severe, unilateral or bilateral, or progressive or stable. Since his hearing loss was mild bilateral at 6 weeks old and is now mild slipping to moderate at 4 years old, this makes me think that congenital CMV would be the etiology.
Yeah, we as a team think the likely cause of Jamie's hearing loss is congenital CMV. Although we can not prove this at this time, we took what we found on his last hearing test and consider the results with his case history to reach this reasonable conclusion. Thanks for tuning in to the Here and Now show. Have a good day.
Bye. Hello, welcome back to the Here and Now show. My name is Brett.
My name is Koryn.
Thanks for tuning in. We've taken our talents to YouTube. Subscribe below. So we are back. It is now 2019. And can you think back to 12 years ago when we talked about Jamie, the most adorable little 4-year-old boy?
Oh my gosh.
Remember him?
Yes, I do.
Yeah. Well, we saw him about a month ago in the clinic. And he came in reporting that his hearing was changed, like drastically, since we last saw him. So we're going to take you to his house and we're going to see what's going on.
His hearing has changed, but ours certainly hasn't with all that hearing protection we've been using.
By the way, you do not look like you've aged a day.
You either.
Thanks. So I'm sitting here with Jamie. Thank you for inviting us to your home. So we saw Jamie first when he was 4 years old, so about 12 years ago. He's now 16 and he loves to play basketball, football, and go hunting. Jamie, how have things been going with your hearing aids?
Things have been going well. I wear my hearing aids during practice, and my coach has the Roger pen, so
you can hear what he's saying.
Absolutely.
That's awesome. We saw you about a month ago at the clinic, and you reported quite the change in your hearing recently. What is your take on this?
Yeah, about a month ago, I felt like I was losing some hearing in my right ear, so that's when my mom made an appointment with you.
And we're glad that you came in. So at that appointment, just so our viewers know, his thresholds in his right ear went from mild and all the way to moderately severe. So mild the last time we saw him, and then moderately severe just a month ago, which is a really big decrease in hearing. And we also saw his word recognition drop to 30%, which is a huge difference in his right ear. Jamie, do you remember what we did at that appointment? You might not remember. So we gave you a mini microphone, remember that?
Yeah.
We taught you how to use it with your friends outside of school,
Yep.
so that you can hear what's going on.
Absolutely.
It streams their voice directly to his hearing aids. We also turned up your right hearing aid to match what your hearing loss was.
Yep.
And we made a lot of referrals and recommendations because we want to get to the bottom of this change.
Yep.
Anything else you have to add?
It's nice. I can stream my music from my iPhone to it, so it's handy.
Lots of our patients like that. Well, thank you, Jamie. Have a great day.
Thank you.
These big changes that we saw in 16-year-old Jamie's hearing had us concerned about a possible acoustic neuroma. When we see a big discrepancy between ears in terms of thresholds and a huge drop in word recognition performance, we take every step to rule out a tumor growing on the auditory nerve. It might seem crazy to think that Jamie has 2 different pathologies causing his hearing loss, but it's better to be safe than sorry. We stress to Jamie and his parents the importance of following up with an ENT to get whatever testing and imaging needed to rule out the presence of a tumor. And for follow-up audiology testing, we recommended IPSI and contralateral acoustic reflex testing to help determine the site of pathology in the audiologic system. We also recommended Jamie receive a neurologic AVR test on his right side. A neurologic pathology would show up on this testing.
We will not rest until we determine the cause of this recent change in Jamie's hearing. But until then, we will continue to provide Jamie with well-fit hearing aids and the hearing assistive devices like his mini mic and Roger pen so that he always has access to sound in and out of school.
Thank you so much for watching today's episode of the Here and Now show featuring Koryn and Brett.
We'll see you on next week's episode. Bye!